Scano, Sego, and good day, Six Nations. I'm here today to plead for your cooperation as we try to stop the spread of COVID-19 within our community. A clear message is that we are in a crisis. Our COVID-19 positive cases have spiked rapidly over the past couple of months, and we are at an all-time high, higher than the City of Toronto by population. We are scared that if we do not get this under control and stop the spread, we will see more deaths and serious illness in our community. We do not want that. No one wants that. Our local health officials are telling us that the high number of active cases and transmission here at Six Nations is from what appears to be a significant number of community members ignoring public health directions to self-isolate, quarantine, and use personal protective equipment. This means that we are spreading amongst ourselves at a high rate. We are potentially harming our own elders, family members, friends, and overall community. We are in a situation where our frontline workers are exhausted and near burnout. These workers include healthcare staff, social services, mental health and crisis staff, our COVID-19 assessment center staff, as well as paramedics, police, firefighters, and more. This impacts you as community members because they are getting to the point where they will not be able to help us any longer. They are tired physically, mentally, and emotionally. The facts we are faced with is that Six Nations has the highest rate of active cases per 100,000 people in the entire province. According to a 5-day average of all 34 public health units in Ontario, between February 25th and March 1st, our community ranked at the top of the list above Thunder Bay, Peel, and the Toronto regions. We are in the news, and this is not fake or exaggerated facts. This is very real. We have to act now before it's too late. So this is what leads me to our important announcement. Six Nations of the Grand River Elected Council approved a resolution on Monday, March 1st to move the territory into a 2-week closure through a 2-step process as we maintain an alert level black. The first step is to implement a 2-week closure of all elected council departments effective today, Thursday, March 4th at 4:30 p.m. The 2-week closure means that departments under the elected council umbrella will be closed during this period, permitting only essential services to remain open. We know this is drastic, but it must be done, and by doing so is sending a strong message to our community that we all individually have to take responsibility and each do our part. The second step is a full outreach and communication to all businesses within the territory to implore the non-essential businesses to follow suit and also implement a 2-week closure in addition to our essential businesses to reduce hours of service. We are doing our best to maintain our community economy during such difficult times, but if our numbers of COVID-19 positive cases continue to increase, we will all lose in the end. This does not mean that all businesses will be closed, so there is no need for panic buying. We will not be setting up checkpoints to enter the territory as we did on the onset of the pandemic. The elected council is committed to working with businesses to help and support while maneuvering through this difficult decision. To this end, we are working to reestablish the Small Business Relief Fund and are planning upcoming Zoom sessions, which will take place Wednesday, March 10th and Thursday, March 11th for community businesses to answer any questions they may have regarding this announcement. To register for these sessions, please contact either Arlene Miracle or Lori Martin by email at arlenemiracle@sixnations.ca or Lori Martin at sixnations.ca. If we do this now, we can stop the spread and reduce transmission before we lose any more people to this deadly virus. The elected council approved this action to our emergency control group to develop an implementation plan which we are sharing with you now. Other points to understand: if anyone has any questions regarding specific department programming and services being affected by this closure, please contact the department director, as well noting that many services are going virtual as much as possible and that staff are still very much working. Also, for non-members, this closure period will mean that operations and businesses within Six Nations will be interrupted in some capacity over the next 2 weeks. COVID-19 vaccinations continue to take place in Six Nations as doses are received, in which we are working diligently to continue asserting pressure to both our provincial and federal counterparts to increase our shipment of vaccinations in a timely manner. Six Nations is working to complete vaccinating those next in line as laid out in our vaccination prioritization matrix. Our Six Nations paramedics and Six Nations Health Services are working together at the new vaccination clinic site located at Emily C. General Elementary School, which has been officially operational as of March 1st. Much like our COVID-19 assessment center, the vaccination clinic also has a strict by appointment only. If you are choosing to receive the vaccine, you can pre-register online at www.sixnationscovid19.ca or by calling 226-227-9288. There will be more information forthcoming in addition to a formal press release to this effect. I would like to now introduce our panel today assisting in delivering this important community announcement. Director of Health Services, Lori Davis-Hill, our Paramedics Manager, David Skye, as well as our Six Nations Police Chief, Darren Montour. I will now turn this update over to Lori Davis-Hill, Director of Health Services.
Nyawa elected Chief Hill and Scano to the community watching this update. I want to take this time to express my deep gratitude to everyone who has done everything they can to protect themselves and the greater community from this virus. I also want to say Nyawangoa to everyone who has contributed to our pandemic response to date. Each of you are heroes for Six Nations. Our entire community needs to be aware of the concerning level of exhaustion our teams of frontline workers are facing. Many of our frontline workers have not stopped working since the onset of this pandemic, with most working and paying attention 7 days a week for almost 365 days straight to protect our community. We are all extremely tired, irritable, concerned, and wondering where we will find the energy to carry on. Our teams are also feeling helpless, as if all their hard work and dedication means nothing to those members that continue to act against public health advice. Yes, I'm speaking to those members that are choosing to ignore critical self-isolation measures. This is putting your community, our community, at risk. I know that many are showing great respect for our public health guidelines, and for those who are doing their part, you are all heroes for this community. Six Nations Health Services, in collaboration with Paramedic Services and our local health unit, continue to work through the first section of the vaccine matrix, with more doses expected in the coming days. This is good news. However, please, we must all show consideration for the greater community and commit to self-isolation and following public health guidelines when exposed, symptomatic, waiting for results, or testing positive. I am pleading with the entire community to step up, to collectively do their part in reducing our numbers and to help pull us out of this COVID crisis. It is the community that is spreading the virus, so at this time, we need each community member to help make a collective effort to stop the spread. For those of you who do not know, Lacey Venivri is the nurse in charge for Oswego Public Health, Ganeos Health Center, and I will be delivering the message from the community's public health unit on her behalf. Sharing concerns to the community from a public health perspective and a community member. Community transmission is at an all-time high, and Six Nations was doing well over the past year to protect our people and fight this pandemic. Each of us are dealing with COVID fatigue and mental stress from isolation, and this was likely a contributing factor in the rise of cases. To the community, please hear me when I say that I feel for and understand the struggles that each of us are dealing with. However, we cannot let our guard down, especially now. The community also needs to know that it will be a few more weeks before community-wide vaccination can take place because of the slow and limited access to and supply of vaccines at this time. Oswego Public Health staff are exhausted. Our frontline workers are expressing feelings of being completely done. We are past the limit of exhaustion and need the community's help and support to pull us out of this crisis. Each member has the power to protect our people, and staying home is the best way to do so. I also want to talk about the COVID-19 variants that are nearing Six Nations and are in surrounding communities, including other First Nations. These variants spread at an even more alarming rate, and members need to be extremely cautious if traveling to other First Nations at this time. This travel should be for absolutely essential purposes only. Thankfully, Six Nations has not reported any variant cases within the community at this point, and we need to keep it that way. We are in a very vulnerable state right now. All of the Oswego Public Health nurses are burnt out to the point that we are in need of more nurses. For any nurses who are interested in supporting our response, please contact Oswego Public Health. This is the highest rate of community transmission we have experienced since the pandemic started. Because of this rapid transmission rate, every community member in Six Nations is encouraged to be tested. This will assist in our fight to reduce the rate of transmission and paint a clearer picture of the actual amount of transmission happening at Six Nations. I know we are all tired of hearing the messaging about health guidelines, but now is not the time to ignore the guidelines. They are in place to keep you and your family, me and my family, and the rest of our community safe. Now is the time to come together to fight back against any further spread of COVID-19 within our community before we lose another member to this virus. We are all in the same storm. We all need to come together to weather this storm to protect our people. Nyawa, and thank you for taking the time to listen. I will now pass this over to David Skye, Manager of Six Nations Paramedic Services.
Nyawa, Lori. As Manager of Six Nations Paramedic Services, I want to express firsthand my level of concern regarding the alarming rate of COVID-19 transmission in our community. I'm tired, my team is tired, but we will continue to carry on to protect our people. We need the support of the entire community to see this through. Surrounding communities are slowly beginning to ease their restrictions while we have remained in alert level black since January 18th. We will continue to be in alert level black until our case count gets under control. Our Six Nations Health Services Department capacity is at high risk of being overwhelmed due to staff burnout. The Six Nations Assessment Center staff are also at high risk due to staff burnout. We have over 123 cases reported in the last 14 days. This is extremely concerning. I will now turn things over to Darren Montour, the Chief of Six Nations Police.
Thank you, David. The Six Nations Police Service have so far been committed to educating the community on COVID-19 and how to gather safely as opposed to enforcing fines under provincial legislation. Enforcement will remain our last resort, but we will not shy away from issuing fines. However, we have come to a point where community disregard of public health guidelines has made this educational approach no longer effective. Effective immediately, the Six Nations Police Service are now considering enforcement options for those individuals and businesses who are not complying with the guidelines. We are still in alert level black, and no community members should be gathering with others outside of their immediate household. We have tried to take a patient and educational approach to the crisis, but it is clear that a stronger message is needed to those who continue to disregard the health and safety of the greater community. To report non-compliant members, please contact the Six Nations Police Service at 519-445-2811. The fines that the Six Nations Police Service are considering to enforce include, but are not limited to, the Quarantine Act. This federal statute deals with persons coming into Canada. Under this legislation, people are required to quarantine for 14 days. Failing to abide by these guidelines, a person can be charged and fined $1,000. The Reopening Act, wherein this provincial statute pertains to social gathering size and stay-at-home orders. Violations of this act are $750. As we have previously stated, our focus is public education for community members to look out for each other, and enforcement being our last option. The community must take this situation seriously to get through this critical time. We're all in this together.
Thank you, Darren, and to the rest of today's panel for joining me in delivering this important community announcement. A quick recap of the update is that we are going into a 2-week closure of departments under the elected council umbrella. We are permitting only essential services to remain open during this closure period. If anyone has questions regarding specific department programming or services, please contact the service itself. For non-members, this closure period will mean an interruption in operations over the next 2 weeks. We ask that you please do not panic buy and rush our community. We will not be putting up checkpoints to enter the territory as we did at the start of the pandemic. Non-essential businesses within the territory are implored to follow suit over the next 2 weeks, in addition to essential businesses reducing their hours of service to help stop the spread. The 2-week closure of elected council departments is effective today at 4:30 p.m. We will also be getting this information to our community through other forms of communication. To all of our community members, we sincerely need to come together to pull ourselves out of this COVID-19 crisis, and I urge you to do your part and help the situation. The true strength of a community in the face of adversity is how we protect each other. Nyawa, and thank you for listening.